Welcome back to the Nursing Ministry channel. Welcome back, welcome back. Our returning viewers, our new viewers, you are all welcome. You are all welcome. And thank you for joining us in today's episode. For the new viewers, my name is Ludia Osita, and this is the Nursing Ministry channel where we're going to learn all matters nursing as a ministry and as a profession. So you are welcome. Now, if this is your first time, you may not understand what you're discussing today. As I always advise, please watch our previous videos. Every video, every episode is a build-up of the next. So we are building up on a certain topic, and it will help you if you are able to follow this sequence for your own benefit. Now, in our last episode, I took us through matters high quality CPR, and we had a scenario, and we performed a CPR on a supposed victim. However, we did not use the AED. AED, we said, was the automated external defibrillator. But I promised that in this episode, we were going to use the AED that we had sent for. So just a quick recap. We had mentioned that scene safety is very important. You have to ensure that it is safe. I gave the example of a patient in a victim or a scenario in a bank, that there was a robbery and all that. So it is not safe to start CPR and yet the robbers are there. So today, let me try a scenario that now we are in a highway and you have seen somebody go into cardiac arrest in the middle of the highway. Maybe they were crossing the road. You will not jump in the middle of the highway and start CPR there. You could get knocked down, yeah? So that gives you an idea that safety first. You move the patient to safety, then you perform the CPR when the environment is safe for both of you. Otherwise, if you start doing it there and get knocked down, there'll be you who is there'll be the victim and you who was trying to help. So safety first. Then secondly, we said that you check for responsiveness, because the person could be asleep, the person could be having low blood sugar, the person could have just fainted and just needs repositioning for them to regain consciousness. So you first check responsiveness. And if you check responsiveness, you're calling them near their ears and you're calling out their name. If you don't know their names, Sir, are you okay? Are you okay? If there is no response, immediately activate the emergency response system, meaning call for help, shout for help, and tell them to come with the AED, automated external defibrillator. I already described somehow how this equipment looks like, or machine looks like rather, and today we'll even look deeper on what it is all about. But shout for help, tell them the situation and ask them to come with the AED. Now, you may say, but you're not yet sure whether this is low blood sugar or cardiac arrest, but let them come with it. In case it was cardiac arrest, at least you've saved the time of them having to go again and start looking for the AED. Should it not be a cardiac arrest, then well and good, you won't have to use it. You continue with whatever other resuscitation measures. Now, after shouting for help, you've activated, you've told them to call for help. You're shouting for them to come with the AED, but we're also telling them to call 911 or the hospital or ambulance, because you will still need this patient to get the attention of the hospital, as you said so, right? So, having done that, you jump in to perform, to do checks, to find out what is going on with this person. So we said you turn them over, check for their pulse, carotid pulse, and check their breathing. Is the breathing present? If yes, then that is a different story. If no, or the breathing seems to be there, agonal gas, that is abnormal breathing, this is an indicator that there is a cardiac arrest that has happened, and we are going to go ahead and do chest compressions as we wait for the AED to come. So this person that you have told them to call 911, call the hospital, call the emergency response system, and come with the AED, has gone to do as you have instructed them. But for you, you will not wait. If you check and you find that the heart is not beating, whether they have their abnormal breathing or whatever else is going on, if the heart is not breathing, we go straight into chest compressions. We have to contract that heart. We have to help the heart now contract to send blood to the brain, to the body. We are doing what the heart would have done for itself, but because it is arrested, it cannot do. Right? So what we do before we start, we had already said what happens. We lay them on a flat surface. The surface has to be firm. And then, what I did not mention, if this person is heavily covered, if it does not delay the CPR, like if you can unbutton or zip, please try and do so that you get to as close to the chest as possible. But if it will delay, do not go into trying to undress them, trying to remove the sleeves, or if it does not delay, if it's a matter of opening, please do so and get to as close to the chest as possible. We've had cases whereby if it's in the hospital, we have to use the scissor to cut off the clothing in order to expose the chest. Quickly cut off. It's in the scissor is in the emergency cut, so it's not something we're looking for. So when the patient comes, if it's not something that can be undone, like buttons open or zipped up, if the clothing is complicated or covered up, they simply cut through. Sometimes they try to cut from the side and rip it open, but they cut through and open, and we move on with the CPR. Now, we have already talked about the CPR, 30 compressions, 2 breaths. 30 compressions, 2 breaths. After every 2 minutes, we confirm, is the pulse still there, not there? How is the pulse? How is the breathing? If nothing has been resolved, we go back 30 compressions, 2 breaths. 30 compressions, 2 breaths. So we do that until the AED arrives. Or if we do that and the patient responds, the victim responds, we place them on the left side, recovery position, but we monitor them. Every 2 minutes, we check responsiveness. If there's no response, check the pulse again and the respiration. If it has now turned back to us, put them back on their back and do 30 to 2, 30 to 2. We continue these cycles. The important thing is to ensure that heart keeps breathing, keeps beating. We have a pulse and we have normal breathing. That is what we are trying to do until the AED comes. Then we immediately, the AED is available, we start using. Now, it may be that the AED is not far. Maybe as we start, we simply do 30 to 2 and the person brings the AED. Maybe it is in the office. So the AED is just located right there. So you may start 1, 2, 3, 28, 29, 30, and the AED arrives. As soon as the AED arrives, it is preferred to the compressions. But I want to now show you in this episode how we are going to use this AED. Do not stop and say the AED is here. Let me now use it. Because that time you are stopping, you could stop for more than 10 seconds. And we said the delay should not be more than 10 seconds. This person is deteriorating and we do not want that. There should be no stop of compressions or working on the patient for more than 10 seconds. Now, my Bible is our AED of the day. I'm going to use it to demonstrate because I do not have a normal AED, but I gave an idea that the AED looks somehow like a laptop. Okay? Now, assuming this is your laptop, this is your AED now, and the person that was going to get the AED, your helper, has now returned. They've gone, they've called the ambulance, they've called the hospital, they've picked the AED and come with it. Now it is you who is still compressing, you're still doing 30, 1,001, 2, 3, 4, 5, 28, 29, 30. And you're going to the mouth and you're giving 2 breaths. You're doing it again, 2 breaths. If you get tired anywhere in this process, you can skip the breaths and just continue now compressing with the energy that you have left until the AED arrives. Of course, when it arrives, you are now tired, but you have done well to do your best. Now that the AED is here, do not stop compressing. If you can compress and do the breaths, continue 30 to 2. But when it comes, if this person does not even know how to operate this AED, you can choose to tell them to jump in and do their compressions and tell them not to stop. Tell them, come and do what I am doing, and ensure that they are doing it correct. Come and do what I am doing as you go and jump to the AED, because you know how to open and to do everything that you're talking about, because you are learning from this video. But peradventure, the person knows how to use the AED, or they are somebody you can give instructions and they do it quickly. They are able to comprehend. Please continue with the chest compression and tell them how to power it on. Then you have the two of you, you can work together. Now, in this case, the AED has come. You are compressing, depending on what you have determined. What you're going to do, the AED, like I said, was simple. Some AEDs are in a case, just like your laptop can be in a case. So you remove the case and put it aside. You need the AED itself. Now, when you open the AED like this, some AEDs, when you open like this, it powers on automatically. It turns on, it powers on. However, others, you may have to open and just like a laptop, press the power button. Like I mentioned, the laptop has so many buttons and keyboard and all that. The AED may have 2 to 3 buttons. That is it. That is how simple it has been made for ease of use by the public. So when you open, if it powers on by itself, give it time to power on. It takes seconds, not like a laptop that may take a minute, 30 seconds or so. It can take 5 to 6 seconds, 10 seconds just to power on, because it's been programmed to work with an emergency. So when it powers on, again, we have 2 types of AEDs. One uses voice prompts. It tells you what to do next verbally. You hear the voice and at the sound instructing you on what to do. Some AEDs, you see it on the screen of the AED. When you open, it is the writing, simple writing, not so many things written. So if it is writing, it may simply say, press, it will give instruction. We're going to see what it will say. What it would have said verbally or verbal promptings will now be written. Please follow the promptings. Don't be so quick as to jump in, power on, analyze, do this. No. Follow what it is saying, because it is moving. There is a way it is moving, and it is moving fast. So it's not something that will be delaying and making you anxious. What's happening? No. So when you open and it has powered on, take the pads, the AED itself, inside the AED pack, you will see there will be pads. Now the pads are 2. Or let me say a set of 2. One for adults and another one for pediatrics. Now, if this person is 8 years old or above, you will use the adult pads. The pads are the size of maybe your phone. One pad is the size of, or even my palm, something like this. This is one pad. And then there's another pad. You need 2 for every victim. 2 pads for every victim. So if it is the big pads and it is drawn, you will see it is drawn an adult. You will know this is for adults. So if this person is either 8 years old or above, you will use the adult pads. If it is somebody below 8 years old, you use the pediatric pads, which is smaller, and it is drawn up as a child. The body, you'll see this is an adult, this is a child drawn. And the good thing, it also shows you where to attach these pads, which is just 2 places. One on the left part, remember our heart is on the left side, it will show you somewhere here. Wherever it is indicated, that is where you're going to apply. And the other one is normally on the right upper part, apply. It does not have to be super accurate. As long as you look at the pad and you see one is on the left and the right, that is where you're going to apply the pads. For the pediatric, look at the drawing. Some of them it is in front and on the back. Others just follow as long as these pads do not touch. If the AED does not have one for a child, you can use the one for the adult. Place one in front and one behind. But please do not put the pads of an adult on a child and make them touch each other, because the electricity will just be passing from one pad to the other and not going to the child themselves. So ensure that if the AED only has for an adult and this person is less than 8 years old, you can use it, because you'd rather have half a loaf is better than a whole bread, right? So just use what you have, but attach one in front, one behind, instead of putting two pads on a child. The child is small, the pads are big. Then when you attach, the pads are touching each other. The electricity will be moving from one pad to the other instead of from the pad to the heart, which is what we want, to shock the heart. Okay, now we are back to our adult. This adult, before you even apply the pads, please determine this thing. Yes, the AED has come. Yes, you've been doing CPR as soon as possible, which is awesome. No delays, no more than 10 seconds delays. You've been compressing. But when the AED comes, if this person is in water, they are lying in water, please, 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 do not use that AED until you remove them from that puddle of water to a drier surface. Now that the person has brought the AED, there's two of you, help each other to drag the patient safely to a dry surface area. That is the first thing with the AED. Water and electricity do not get along. There will be electrocution there of the victim, of yourselves who are around there. There will be more people being shocked around there. So you do not want any water. If it is a puddle of water, draw the person to a dry surface area, and that is where now you will use the AED. Number two, if it is snow, they are in snow, it is okay. Because it is not water, they are laying on the snow. If there is no water around, it is just snow, go ahead and continue using the AED. Don't say the snow melts to water and so the water with electricity, electrocution, no. If it is snow, go ahead and use the AED. Number three, if what they're laying on is a small amount of water at the back, it's not a puddle of water, go ahead and use the AED, because the pads and the AED is not touching that water, that small amount of water. So don't say they were laying on some urine or water, so no, go ahead and use it. So in this case, the only exception is a puddle of water, a lot of water that can cause electrocution. Point number two, before you attach these pads, do not attach on top of the clothing. Like I said, if the scissor cut, if it's buttons, rip it off. Just move, zip and zip. You want skin to pad, not the pad on your shirt and clothing, no. The pad on the skin surface. That is another pointer to consider. So ensure the chest is bare, the skin is exposed. Number four, should you open and the person is hairy, please do not apply the pad on the hair, because it will not stick on the skin and work as it should. The machine may even start telling you to check the electrodes. The electrodes is the pads there, because it is not getting any information between the AED and the person. So it will start detecting something is wrong, and that is because your pads are on the hair. So you do not want to do that. So what you will do, if you check the AED, some AEDs come with a razor blade. Go ahead and quickly swipe out the hair so that you have the skin exposed. Don't shave the whole chest. All you want is to shave the area where you're going to apply the pad. So if you're going to apply on the right part and there's hair there, just do 1 or 2 swipes to get access to the skin where you will apply the pad. If on the left side there's no hair here, go ahead and apply. You don't have to shave again. Remember, we are racing against time. Now, all this while, when we're determining all these things, compressions are still ongoing. There's 2 of you, the one who brought the AED and you doing the compression. So continue with the compressions, 30 to 2, 30 to 2, As these things are going on, opening, powering on the AED, removing the pads. We want to attach the pads, but where are we attaching? Is there hair? We have to remove that hair first, okay? Is there water? We have to wipe away the water. Maybe as they were doing it, the person had water on them. Wipe the water away. You've removed them from that puddle of water. Wipe the water away before you apply your pad. If they were hairy, shave the hair before applying the pad. If the AED did not come with any razor blade, don't run back for a razor blade. If there was the pediatric pad, take the pediatric pad, peel off the pad, because remember it is sticky. You want to remove the seal. So remove that cover and you have the sticky part. Apply where you want to put your pad. Apply, then rip off the hair. This person is unconscious. They're not feeling pain. We are interested in their lives. So put that pediatric pad, or if there's a second pad, maybe there was a second set, there were two for adults. Use one for peeling the hair, then the other one now for performing your electrocution. So no hair, remove the hair before you apply now the fresh pad. Okay. Having said that, no hair, another thing, you cannot apply the pad if the victim has a patch. A patch may be that this person is in chronic pain. They keep having pain. So instead of the doctor prescribing pills for them to be swallowing every 4 hours, every 6 hours, instead of that, they've been given a patch to apply. Now the medication is in this patch. You remove the cover and you attach it on the skin. So the prescription may be that the patch is valid for 72 hours, 12 hours, 6 hours. It doesn't matter. As long as you see any kind of such a patch, medication patch, do not apply that pad on top of the patch. Now, if it is on the left side, we are not applying the pad here. It is okay. Let it not trouble you. We are talking about the area where the pad indicates you should attach. It should be attached. So if it says attach on the right upper part, and yet when you're going to apply, you notice there is a patch there, kindly remove that patch before applying your pad. Remove the patch before applying your pad. Okay? If on the one on the left part, there is a patch there, remove that patch before applying a pad. Do not put the pad on top of the patch and say this is an emergency. The electrical conductivity will be hindered by that patch there. So that is another point to consider. The patch may be for pain medication. It may be a nicotine patch, the ones that the smokers use if they want to wean off cigarette smoking. So remove it. It's not important. We need that area of the pad clear. Then I think finally, they may have an implantable pot inside of them. Now, implantable, you will see something solid. It is hard. You can even see it visibly. There is something in here. It could be a port for medication injection. It could be a port, maybe an implantable cardiovascular defibrillator that was put in case they have heart attack. It can kick in. As long as it is a port and it is on the area that you want to apply the pad, do not put it there. Even if the pad has indicated put one pad here, put one pad here. If the place you're going to put has an implantable cardiovascular, since you cannot go into the body and remove the ICD, and just place that pad slightly below that ICD or that implantable device. Don't put on top of it because again, it will interfere with the electrical conductivity. Just to name a few that you don't want anything hindering the pads. Where the pad is going to be placed should be skin. It should be clear. Then another thing is that once you've determined that and now the pads have been placed, this is the pad. You have two pads, right? You have two pads. I've said it's the size of the palm of the hand for the adults. So you have one pad and another pad. One pad has its cable like this. There's a pad here, and the other pad has its cable. So you have two of them. It's making a Y. One of the pads you have placed here, the other pad you have placed here. So what is left now is this part. Your AED that you have that is powered on will now tell you connect the cord. Connect this cord into the AED. Now you want to connect the AED itself to the patient. So this is our AED. It has prompted you, you've opened it. It has powered on, or if it doesn't power itself on, you have placed power. Now it is giving you instructions. It is telling you, connect the cord. This cord that is attached to your patient with the pads, connect it now to the AED. Now we have communications between the AED and our patient with the pads. Please behave, my AED. Okay, there we go. Our AED, assume it is open. We have our AED here and we have our patient here. Now there is that connection, right? Once connected, the AED now is able to determine what is going on with this patient. Now all this time, even during this time the AED is saying connect, you are still doing the compressions, 30 compressions, 1001, 2, 3, 4, 28, 29, 30, and then giving 2 breaths. The other person is the one doing all this patch, placing the pad, shaving, ensuring the patch is off, making sure what have you, and now has connected. Now, the fact that they have connected, do not stop compressing. Keep pressing that heart, keep giving the breaths. If you are tired, at least continue compressing. Or tell this person to now come and compress for you to go to the AED, because operating the AED does not demand so much energy. So at least you'll be resting. When this person compressing gets tired, switch and come back and let them come to the AED. Keep doing that, as long as they understand how to use it. And should they say that it doesn't take long. Once the AED arrives, 2 minutes at most, unless you had to shave, maybe 2.5 minutes. So by that time, even if they're tired, your AED should be ready to use. So we're not talking about 5 minutes with the AED. So even if they're getting tired, by then maybe 1 minute or 2 minutes is over. But if you see that truly they're tired, that they just want to stop, you'd rather jump in and compress and tell them what to do with the AED. Because it is only 3 buttons you're dealing with, instruct them, okay? Now, our AED connected as instructed by the AED prompt. And then here we have our cable connected to the patient and the pads are in place. Now the AED, once it senses that, it will say, clear for shock analysis. It may use any word. It may even just say analyzing shock, or it may say analysis. As long as you know that the word analysis is there, it is what it means is you should clear the patient. No one should touch the patient. So it is telling you to ensure that no one is touching the patient, because it wants to analyze what is going on, the electrical impulses, or what is it that is going on with this patient for them to get into this cardiac arrest. So what it is saying is clear, meaning it is telling you check. Now you who now knows what happens when you hear analyzing shock, analyzing for shock, what you should do, say aloud, I am clear, meaning there is no part of my body in contact with this victim. I am clear. Then you should say everybody clear. As you say everybody clear, look at who else is around. If it is just one person, ensure that that person is clear. Don't just say I am clear, everybody clear, we are all clear. As you say I am clear, make sure truly there is no part of you, even your knees are not touching the patient. Then look at the person you're saying everybody clear, that no part of their body is touching this patient. Then say we are all clear. After that, there is one button that is for analyzing the shock. Since the AED has said clear for a shock analysis, it will not do anything until you come and press that analysis button. So when it tells you to clear, it is telling you ensure everybody is out of view, and then come and press the analysis button. So if you have confirmed, yes, we are all clear, go ahead and press the analysis button. When you do that, now that is the point. You have cleared, everyone has cleared. That is the only time the chest compressions can stop. It is stopping, and it doesn't take 4 seconds, 3 seconds for the analysis. So we are still safe within our 10-second gap, that 10-second delay that we should not cross over. We are still within. So at least we are safe for the AED to determine whether this is a shockable rhythm. Now, I'll pause here to explain what is going on. When it is saying it is analyzing for shock, the AED has sent some, it is now inside, it is now detecting. Remember, it's connected to the patient via the 2 pads. It is now able to determine in this heart what electrical rhythm is going on. Now, if you look at this channel, the Nursing Ministry channel, the introductory video, you will see videos, clips and all, but there's one that shows you the heart monitor, where the heart rhythm reads. That is what this AED is trying to determine. But there's really no need for a screen, because even if the screen is there, you may not know how to use it. Remember, the AED is mostly for the public. So not everyone knows how to read the monitors. If it comes with it, well and good, but it is, most of them do not even have the rhythm. So it is going to determine, is this a normal sinus rhythm? Is it a ventricular fibrillation, ventricular tachycardia, ventricular, is it bradycardic? What is going on? Is it a flat line, asystole? So it is trying to determine among the rhythms, what rhythm are we dealing with? Because not each and every one of these rhythms are shockable. If you press shock and you have, for instance, asystole, nothing may happen, because it is not a shockable rhythm. If you press shock and you have one type of rhythm or the other, you will make the situation worse. Now you've caused the heart now even to lose direction. You've taken the whole thing into a different trajectory, which is now worse than what was there before. It is as good as never even connecting the patient to the AED in the first place. That is why it has to analyze and determine, is this a rhythm that I'm detecting that can be shocked, or it is not shockable? If it sends out a rhythm, and if it sends out a prompt, because you have to now let the AED do its thing and tell you and prompt you on what is going on. So all it may tell you is either it is shockable or it is not shockable. 2 things. It won't give you stories, ventricular fibrillation or atrial flutter. It will not tell you what rhythm is going on. It will only give you 2 prompts. Either you shock or do not shock. And it may come in different prompts. Either it will say shock patient, or shock, or simply non-shockable rhythm, shockable rhythm. So it is for you to just hear whether it is for a shock or not shockable. Simple. Simple. Is it shockable or not shockable? So after it has analyzed within 2, 3, 4 seconds, listen to the prompt. If it is not a voiceover, it may write on the screen shock or non-shockable. If it says non-shockable, do not press anything else. Jump back on the chest. Go back to that rhythm of 30 times, 2 breaths. 30 times, 2 breaths. 30 times, 2 breaths. 1,001, 2, 3, 4, 5, 28, 29, 30. Give 2 breaths. After 2 minutes, remember when we didn't have an AED, after 2 minutes, what were we doing? We would check the pulse and we'd check the breaths. Pulse and breath. If there's no pulse back, we continued 30 times to 2 breaths. 30 compressions to 2 breaths. After 2 minutes, what did we do? We were coming back to check the pulse and the breaths. But now that we have the AED, When we do 30 compressions and 2 breaths, 30 compressions and 2 breaths, and 2 minutes have elapsed, we come back to the AED to analyze again. Press the analyze button. And sometimes the AED itself will tell you before even by around the 2 minutes, before you even come to do it yourself, because I said they are all similar but not quite the same. It may tell you clear for analysis. So while you are doing 30 to 2, 30 to 2, maybe even after 3 cycles, it may prompt you and tell you clear for analysis. So it is upon you again to say, I am clear, everybody is clear, we are all clear. And then press the analysis button. So it will prompt you. You just need to continue 30 to 2, 30 to 2, and wait for the AED itself to prompt you. And it will tell you clear for analysis. It won't start clearing until now you have determined you're clear and you press the analyze button. Then again, it analyzes within 2-3 seconds and it tells you whether it is a shockable rhythm or not. If it still says no, go back and compress the chest and give 2 breaths. Compress the chest and give 2 breaths. Compress the chest and give 2 breaths. Okay? Until again it tells you clear for analysis. Clear, clear everyone. Then press analysis button because you don't want anyone to be touching. Press analysis button. Now, peradventure the 3rd time or the 4th time when you press the analysis button, it tells you shockable rhythm. That tells you when you are compressing on the heart, the first time it may not be shockable, second time it may not be shockable, but as you continue compressing, maybe the heart has picked up a different rhythm now that will allow to be shocked. So don't always assume because it said non-shockable at the first place, let's just continue. No. Until that time it says shockable, because it can change. Now when it says shockable, once again, ensure no one is touching the patient. Say, ready for shock. I am clear. Everybody is clear. We are all clear. Shock. Be verbal. Speak so that everyone knows what is going on. I am clear. Everybody is clear. It is your responsibility who is going to press the shock button to ensure that everything is clear. So now we are clear. Press the shock button. The shock button may be written shock. It may have that electrical sign to tell you this is where we are shocking. So press the button. And when you press, because the patient now has the pads, the 2 pads that are attached on them, when you press shock, you will see them jerk because you're electrocuting them. So they will jerk. Now, when they jerk, if there is no response from the patient, they're not opening eyes, they're not moving in a way that you're saying, they are back. If there is no response, as soon as you shock, go back and continue 30 compressions to 2, 30 to 2, 30 to 2. Even the AED knows that when you shocked, the patient did not respond to that shock. So it will still know that we still have a victim here to work on. Your job is, after you have shocked, there is no response, continue compressing 30 times to 2. 30 times to 2. It may be that after your 2nd round, the patient comes back. That is where now you turn the patient to the recovery position. Do not remove the pad from the patient. Let it stay there until they will get to the hospital. They will know how to work with because the pads can do so many things, not just with the AED. It can still be connected to the monitor and all. So these pads that you've connected, do not remove. Goodness knows that when you have shocked and they're back, they're on their recovery. Remember from our previous episode, after 2 minutes as you're monitoring them, they may get back to that situation. So you do not want again to start looking for the pads. Maybe that was the only pair of pads. Now you have removed it. Now again, they've gone back into a worse situation or their situation has deteriorated. The sticky part may get loose if you remove and try to attach again. So these pads should stay there until they go to hospital. Let the hospital determine how to go about it, whether they will replace it with the electrodes or use it for other purposes. Leave the pad in place, okay? So if they come back, simply turn them on the recovery position. Let them stay there while you're waiting for the ambulance to come. Or if the ambulance is not coming, like I said, every system is different. You may have called them, they will say they are coming. By the time you're checking on them, they've shut off the phone, you're on your own. Now you have to determine what next. If the patient is back, you can pick the patient now, it is safe, put them in the car and rush them to hospital, because now their heart is beating. Rush them to hospital using private means or a good Samaritan, or if it's a public means, they're willing to take the patient and use it as a cab to take the patient to hospital. You can now carry the patient into the car and take them to hospital. However, if you shocked them and they did not respond to it, I said go back to 30 compressions and 2 breaths. 30 compressions and 2 breaths until the AED prompts you to analyze the shock again, whether it is shockable or not. So you clear everyone, press the analysis button, let it determine for you whether it's shockable or not. It may say not shockable, despite the fact that the first one was shockable. This time it may say not shockable. Please do not shock. Go back to compressions. Just follow what the machine is telling you, the AED is saying. Now, this is what you keep doing back and forth, following prompts. If it's shockable, you shock. After shocking, if the patient is not back, continue compressing 30 to 2 breaths, 30 compressions to 2 breaths. AED says analyze, clear everyone, press analysis. It says not shockable, go back 30 to 2, switch positions. Don't get tired and say, well, at least I'm trying. Switch positions. If more help comes, let them compress. Just change positions. But it should take you just 5 seconds to change position. Let it not take a long time. You're moving, or move. No, you should move very fast. And make sure you're saying you're tired. Before you leave and say, I'm tired, say you're tired while you're compressing so that the other person is ready to take over. That heart must continue being compressed. Keep doing it until the help comes. Unfortunately, you may have called for help, you may have shouted, you may have gotten the AED by yourself, you may have done your best. The only other time you are allowed to stop is if you get so exhausted. Because even if you do this, you're not doing anything. So if you really get exhausted, you've done your best, don't stop and sit there. At least now make phone calls and say, I've been doing these compressions. I'm tired, please, I need help. Try and call. But you're allowed to go back and continue compressing. Just do your best until more help comes. The person to declare this victim dead is not you. It is a medical doctor in a healthcare facility. So if the ambulance comes and they find you, you've been trying, you're tired, and then after getting tired, you've rested, you go back, well and good, you're doing well. If you pause because you are tired, there was no one else, you are alone with your AED, you've been shocking and going back and forth, and now the ambulance has come after 1 hour, you had paused because you are tired, but you went back in. It is for the medics and the doctors to declare them dead. They could come in and say, no, this person, or they simply come and do what they've been trained to do and take them to hospital. That is where now they will pronounce them dead, or they will say, yes, they are back. They'll connect them to machines. But that delay, unless by divine intervention, that delay has caused some damage. They may be brain dead. They may have to depend on machines. They may recover, yes, but with disabilities, depending on how much the damage is, it will determine what level of disability this person will suffer. But because you're a nursing ministry and we want to think the very best, let's just say they will recover. They will come back whole and hearty. It will be a miracle. Miracles still do happen. Miracles still do happen. So you just do your best, but at least you now understand the dynamics of the AED. So when the team comes in, or if this person gets to return, now they're okay, you've turned them on the left. If no ambulance is coming because of the community, maybe they've shut off their phone, there's no ambulance available, or you call them and you ask them, when you are asking them, how far are you? If they say it is very far and yet the person is now okay, you can tell them the person is back. Can we please put them in the car and rush them to the nearest hospital? That I will tell you, not just any hospital. I will explain why not just any hospital, because some of them, their post-cardiac arrest care may not really benefit the patient. Yes, they are a hospital, they are doing the best with what facility they have, but they may not be able to detect what caused that because they don't have a cath lab, their emergency department is limited, they may not have the machines to determine what caused it. So what's the point of rushing them there and then putting them in the car again to rush them somewhere else? You might as well have identified somewhere you know this is the hospital that is well equipped, that they can take over now and increase the chances of survival. Now, ladies and gentlemen, I think for today, this is where I will stop. You now understand how the AED works. When the person is back to normal, you are allowed now to remove the connection between the AED and the pads, but let the pads remain on the patient. So that if condition changes, you plug them back again, follow the prompts again, shock them if it's shockable, keep compressing like that. But let this remain with the patient. This one you can detach, and as you are transferring them to hospital, go with the AED until you hand them over to hospital. But if the emergency medical services arrives, they have their own monitor. Now that is the importance of this pad, because they will connect it to their monitor, or they may connect their own electrodes and still leave the pad on. They can work with that depending on how they choose to do it. Now what they're coming with is what we now call the defibrillator. The red thing, if you've watched movies, that one that now they place the pads on your chest and the shock, or they could use the pads you attach to even deliver the shock. But the good thing with the monitor they're coming with, now they're able to see the rhythm. So in nursing and with the medics and the healthcare system, we are taught how to read those rhythms, so that when I will see this is a normal sinus rhythm, or I will see this person has tachycardia, the heart is beating very fast, or I will see the gaps and be able to read and say, this is bradycardia. Yes, there is the heart rate. It is normal, but it is slower than normal because it is less than 60 beats a minute, or less than 40, or it is 30, or all that. Or I will look and see a flat line and say, there's a flat line. This is what we need to do. Now, when they are coming is what we'll discuss in our next episode. Because now they're coming with more than just a monitor and a defibrillator. They're coming to insert needles. They're coming to intubate if need be. They're coming to put oxygen, which you don't have. You who's been a good Samaritan, doing an awesome job, trying to keep this person with you until advanced care now comes to take over and do the best they can to now ensure the patient is alive. And if they're alive, to rush them to hospital, give the report, and then they determine what was wrong, what they can intervene to ensure that this person does not fall back into another cardiac arrest, or their recovery is smoother and whatever damage is there does not deteriorate further. I hope I have helped you. My Bible has been a good AED. When you will be remembering it, you'll be remembering the AED and the connections and all that. But please, if you get a chance, go to Google, go to YouTube, try and figure out. They have these videos of the AED to have a better understanding, because you never know when that emergency will hit. That is, you don't want that to be your very first time powering on, checking and pressing the shock button instead of the power button and being all confused. Time matters. As soon as the AED is available, it should be used. And very, very, very important note to close this episode with: do not stop the compressions. Even when the pads are being, the person is being shaved, the person is being wiped, the clothing is being torn, their pads are being attached, Your hands are still on that chest doing the compression while the other person is cleaning them, while they are cutting off the cloth or opening, while they are attaching the pads. You continue. They can do it while you are compressing. Do not stop. 30 times, 2 breaths. Come back 30 times. Let them be setting up everything. If they do not know how to use it, they have done well, they have done their best, they have even shown up to run and get the AED. Give them that credit. Let them come and do the compressions as you're doing it, as you quickly, within a minute or two, you should have that AED ready to analyze the shock. Until next time, ladies and gentlemen, have a beautiful day. Refer to our previous episode about the 4 lepers who simply showed up and the Lord took over. Even you, even though you may forget analysis button, shock button, what have you, when you get that AED, simply open it. And you'll be shocked how you'll be able to do all the analysis, how you will remember to move from one compression to the breaths to the AED and all that until the emergency comes. So don't look at the AED and say you forgot how to use it. Simply show up, simply open it, simply power it. Let the prompts lead you and you will still save a life because you showed up and God took over to bring to sustain this person. Let the Lord do the rest. And again, death is a part of living. Should you lose your patient, you did your best. It is God who gives us the breath of life. If you've done your best and the person still passed away, we look at the very end, what we call debriefing. What happens after every resuscitation attempt? What happens? Whether the person lives, whether it is a successful resuscitation, whether the person dies, we normally have debriefing moments to recap everything that happened so that no one will feel guilty. No one will go committing suicide thinking, I learned this thing, why didn't I pay attention? I saw this situation in a dream, why didn't I pray? Why didn't I intervene? Why didn't I fast? I could have done better. Why, when I was tired, I should have just kept going? Why did I stop for 5 minutes to rest? If you were alone, there was nothing much you could have done. So the debriefing moment helps us. All right, ladies and gentlemen, let me leave you at that. Until next time, have a beautiful day and thank you for joining me in this episode. Go ahead and save a life and may God bless you. Goodbye.